Hi everyone, today's screencast is going to cover heart disease. Please make sure you have a pen and some paper before we start. Once you've got a pen and some paper, make sure you write down today's LO, which is to understand heart disease and how it can be treated. Once you've written down today's LO, have a go at these retrieval practice questions. These questions are from earlier in the organisation topic. They relate to the heart and they're important for today's screencast. Pause the video and have a go at these questions, and then on the next slide there are some more questions that are relevant to today's screencast. For these questions, see if you can add all of the labels to these diagrams. Write the numbers onto your piece of paper and write down the label that associates to that number next to the number on your page. Make sure you pause the screencast. Once you're finished, play the screencast and we'll go through the answers. Okay, so the answers to the first lot of retrieval questions are now on the screen. The first three questions are all about blood vessels and their structure and function, and the last is about the human circulatory system as a whole. I've put down here some diagrams of arteries, veins, and capillaries just so you can visualize what they look like. The next lot of answers are now on the screen. Make sure you're marking these in a different colour. Correct any that you have got wrong. Make sure that you do your corrections so that you can use your notes for revision. Today we're going to look at the coronary arteries. These are arteries that supply the blood with oxygen. So the heart is made of cardiac muscle cells, which, like all of the cells in the body, need a supply of blood to deliver oxygen, glucose, and other nutrients, and also to remove waste products such as carbon dioxide. The blood is supplied to the heart by the coronary arteries, which branch off from the aorta. The heart needs to constantly respire, so it's vital that the heart receives a good supply of oxygen. I've put this diagram here just to show you where the coronary arteries can be found. So they actually surround the outside of the heart. Heart disease is any disorder which affects the heart. So there's a lot of different types of heart disease. The most prominent heart disease that causes the most deaths in the UK is coronary heart disease. It's responsible for 82,000 deaths in the UK per year, which is an average of 224 people per day. This diagram here shows us what is actually happening inside an artery of a patient that suffers with coronary heart disease. So you get a buildup of something called a plaque, and a plaque is a buildup of mainly cholesterol but also white blood cells, and it causes the lumen of the artery to become a lot more narrow. Coronary heart disease is where you have layers of fatty material building up inside the coronary arteries. We've just said these fatty deposits are mainly formed from cholesterol. There are two main sources of cholesterol in the body. So the first one is your diet. If you eat animal products, you will consume some cholesterol in your diet. Cholesterol is also synthesized by our liver. So we actually produce cholesterol in our bodies as well. If a coronary artery becomes blocked by a fatty deposit, it loses its elasticity, so it can't stretch enough to accommodate the blood that's being forced through when the heart contracts. This obviously will reduce the blood that can flow through the arteries, and this results in a lack of oxygen for the heart muscle. So again, this diagram indicates really well what is happening inside our arteries. So this would be your normal artery with no blockage. The blood can flow straight through, and we can see here on the side, the lumen is not blocked at all. Here, if we've got narrowing of the artery, here's your plaque building up, the layers of fatty material and cholesterol. You can see that the blood flow is abnormal here. It's restricted. And if we look at it on the side, you can see that the lumen is greatly narrowed. You can have a partial blockage of the artery, so it restricts the blood flow to the cardiac muscle cells. It results in severe chest pains called angina. If you have a complete blockage, that means that cells in an area of the heart will not be able to respire aerobically. So they won't get enough oxygen to allow them to respire aerobically, which can lead to a heart attack. It causes the heart cells to die. Treatments of coronary heart disease involve either increasing the width of the lumen using a stent, or you can prescribe statins, which lower blood cholesterol. So we'll start with stents. We're going to look at both treatments in a little bit more detail. So like we said before, stents can be used to keep the coronary arteries open. A narrow tube is threaded up through the groin, up towards the blocked vessel. So once it reaches the right vessel, a tiny balloon is then inflated. So you can see that happening here. The balloon has the stent around it. Now the stent's either made of plastic or metal. And as you blow up the balloon, it pushes the stent outwards to widen the lumen of the artery. It increases the width of the lumen. Once you have inflated the balloon and the stent is in place, the balloon and the tube are then removed, just leaving the stent in place. Inserting a stent into a blocked artery is a relatively simple surgical procedure. Stents are really effective at reducing the risk of a heart attack because they widen the lumen so the blood can flow easier through the coronary arteries. Although this procedure is very simple, as with any surgical procedure, there are risks involved, and one of those risks is infection. Stents can also last for a really long time, which is a positive. However, there's a risk of blood clots or thrombosis occurring around the stent, so patients must take blood thinning medication most of the time for life. If we move on to statins now, statins are a drug that are widely used to reduce the levels of fatty deposits or cholesterol in the blood. They actually work by blocking an enzyme in the liver which is needed to make cholesterol, and this slows down the rate of the fatty material building up in the blood, reducing the risk of coronary heart disease actually occurring. There are a lot of different advantages and disadvantages of statins. This table here summarises them. Pause the video, have a read through them. You will need this information later in the screencast. Your task now is to complete the exam question below. You can use your notes to help you if you've made some, and if you need to, you can rewind the screencast for help. In coronary heart disease, layers of fatty material build up inside the coronary arteries. This can cause a heart attack. Statins and stents can be used to reduce the risk of a heart attack in people with coronary heart disease. Evaluate the use of stents and statins in people with coronary heart disease. Remember to include a justified conclusion. So evaluate means we need to have advantages and disadvantages of both statins and stents. We also need to remember our conclusion, which is our opinion, backed up by our evidence from our answer. So you need to decide whether you think statins are better or stents. Pause the video and have a go at this question. To go through the answer to this question, I have put on the screen the mark scheme that an examiner would have. You can get different levels of answers and you get a different number of marks per level. So pause the screencast, have a look through these points so that you know how to answer these types of questions and what an examiner will be looking for. Read through these points as well. These are the points you could include. To gain all 6 marks, you need at least one advantage and one disadvantage of both stents and statins in a well-structured answer. You then need your justified conclusion that's your own opinion but backed up by points you've made in your answer. On the next slide, I will put up a model answer. You can read through the answer as an example of how to answer these kind of questions. So here's your model answer. Make sure you read through this answer, and if you need to make notes, then feel free. Pause the screencast, have a look at the answer. You are going to need to know how to answer these evaluate questions. We're going to move on now to faulty heart valves, which are another type of heart disease. The heart valves play a vital role in ensuring that blood is pumped from the atria to the ventricles and then from the ventricles to the arteries. So they make sure that blood is only flowing in one direction through the heart. In some people, the heart valves may become faulty as a result of either illness, old age, or even a heart attack. Faulty heart valves can stiffen. This can prevent them from opening fully, and this restricts blood, so blood can't flow through properly. They can also become faulty if they don't close properly, and this is when they develop leaks, so blood actually flows backwards. It flows in the opposite direction. Both of these issues reduce the effectiveness of the heart in pumping oxygenated blood around the body. Faulty valves can be replaced with biological valves from an animal or a human donor, or mechanical valves. Pause the screencast and have a read through this information. Your next task is to answer the questions below. You can use your notes to help you if you need to. You can rewind the screencast. Okay, once you've done that, mark your answers. The answers are on the screen now. Please make sure that you correct your answers and add any detail that you might have missed. Okay, we're now going to look at heart failure. So in the case of heart failure, a heart or the heart and lungs for individuals with diseased lungs can be transplanted from a donor who's recently died. Unfortunately, waiting lists for organs are long and organs aren't immediately available. So a short-term solution, or it can be long-term if necessary, involves replacing a heart with an artificial one like this one shown here that's made from plastic and metal. These can be used to keep patients alive while they wait for a heart transplant. They can also be used to allow the heart to rest as an aid to recovery. Artificial hearts do have advantages and disadvantages. So I'll leave these on the screen, I'll let you read through them, but there's less of a wait for one to become available. That is the main advantage because they are manufactured. There's also less chance of the patient's immune system rejecting the artificial heart because it hasn't come from another human or another animal. Artificial hearts don't always work as well as real hearts at pumping blood around the body. They do increase the risk of blood clots occurring around different parts of the heart, and it increases the likelihood of a stroke, and patients will need to take blood thinning medication probably for the rest of their lives if they have an artificial heart long term. Heart transplants will cure any issues with the heart and can be life-saving because they are effectively getting a new heart. Advances in technology mean that heart transplants can now last for around 10 years. However, a heart transplant is major surgery. The procedure lasts up to 4 hours and it involves the ribcage being opened up. It can lead to infection and it can take quite a while for a patient to recover from having heart surgery. Heart donors aren't easy to find. There's high demand for the donor hearts and the patients are prioritised according to their need. Not all donor hearts are suitable. If the tissue and the blood type don't match that of the patient, then the heart can't be used on that patient. The patient must also take anti-rejection drugs for the rest of their life to stop their immune system from attacking their donor heart. These drugs can also affect the patient's overall immunity, meaning they're more susceptible to things like colds and flu and common illnesses that people would normally be able to fight off. Your task now is to answer the questions below. Same as before, use your notes to help you. If you need to, you can rewind the screencast. Pause the video now and have a go at these questions. The answers to the first two questions are now on the screen. Please make sure that you do mark all your questions and add any corrections or extra detail. You can then use your notes from this screencast as revision. And the answer to question 3 is now on the screen. Please remember that you need a pro and a con, or an advantage and a disadvantage of each of these treatments, so of artificial hearts and heart transplants, to compare them and evaluate them against each other. You then need to decide which, in your opinion, is a better treatment for heart failure, and then you need to back up your opinion by summarising your evidence. Please make sure you add as much detail as possible to your answers, and then you can use your notes from this screencast as revision.